seniors losing their Medicaid coverage. I'm Tyrone Bowman. This is Tyrone Bowman Tonight. As Medicaid purge begins, staggering numbers of Americans are losing their coverage. According to KFF Health News, more than 600,000 Americans have lost Medicaid coverage since pandemic protections ended on April 1st. And a KFF Health News analysis of state data shows that the vast majority were removed from state rolls for not completing paperwork. So check this out. Under normal circumstances, states review their Medicaid enrollment list regularly to ensure every recipient qualifies for coverage. But because of a nationwide plan pause in those reviews during the pandemic, the Health Insurance Program for Low-Income and Disabled Americans kept people covered even if they no longer qualified. Now, in what's known as the Medicaid unwinding, states are combing through rolls and deciding who stays and who goes. People who are no longer eligible or don't complete paperwork in time will be dropped. The overwhelming majority of people who have lost coverage in most states were dropped because of technicalities, not because state officials determined they no longer meet Medicaid income limits. 4 out of every 5 people dropped so far either never returned the paperwork or omitted required documents, according to a KFF Health News analysis of data from 11 states that provided details on recent cancellations. New analysis of data from 11 states that provided details on recent cancellations. Now, lawmakers and advocates are expressing alarm over the volume of people losing coverage and, in some states, calling to pause the process. KFF Health News sought data from the 19 states that started cancellations by May 1st. Based on records from 14 states that provided detailed numbers either in response to a public records request or by posting online, 36% of people whose eligibility, slip of the tongue here, 36% of people whose eligibility was reviewed have been disenrolled. In Indiana, 55,000 residents lost coverage in the first month of the unwinding, 89% for procedural reasons like not returning renewal forms. State Representative Ed Clear, a Republican, expressed dismay at those staggering numbers. In a May 24th Medicaid Advisory Group meeting, repeatedly questioning state officials about forms mailed to out-of-date addresses and urging them to give people more than 2 weeks' notice before canceling their coverage. Cleary warned that the cancellation is in motion and avoiding revolving door. Some people dropped from Medicaid will have to forego filling prescriptions and cancel doctor's visits because they can't afford care. Months down the line, after untreated chronic illnesses spiral out of control, they'll end up in the emergency room where social workers will need again to help them join the program, he said. Before the unwinding, more than 1 in 14 Americans, or 93 million, were covered by Medicaid or CHIP, the Children's Health Insurance Program. Parents, listen carefully. According to KFF Health News analysis of the latest enrollment data, half of all kids are covered by the programs. About 15 million people will be dropped over the next year as states review participants' eligibility in monthly trenches. Most people will find health coverage through new jobs or qualify for subsidized plans through the Affordable Care Act, but millions of others, including many children, will become uninsured and unable to afford basic prescriptions or preventive care. The uninsured rate among those under 65 is projected to rise from a historical low of 8.3% today to 90 to 9.3% next year, according to the Congressional Budget Office. Because each state is handling the unwinding differently, the shares of enrollees dropped in the first weeks varies widely. Several states are first reviewing people officials believe who are no longer eligible or who haven't recently used their insurance. High cancellation rates in those states should level out as the agencies move on to people who likely still qualify. In Utah, nearly 56% of people included in early reviews were dropped. In New Hampshire, 44% received cancellation letters within the first 2 months, almost all for procedural reasons like not returning paperwork. So sit down, get the paperwork done, and make sure that you're not one of the millions of individuals who lose their Medicaid health coverage. I'm Tyrone Bowman. Never surrender, never quit.